most famous physical therapist on the internet.
Hi, folks. I'm Bob Schupp, physical therapist.
We're going? I'm Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Time to wake up, Brad. I know you wanted to stay in bed this morning,
Good thing I got the lines memorized.
Yeah. Today, we're going to talk about chronic piriformis and hip pain. And fix it yourself. We're going to show you 3 steps to do so.
That's right, Bob. 1, 2, 3.
All right. If you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, go to bobandbrad.com, and you're going to want to go to the giveaway section because this week we are giving away a Sleepovation mattress.
Look at this baby.
Yeah.
They come much bigger than this. This is just a sample, and it's a cutaway view so you can see how they're made.
Yeah, you won't be able to see that at home unless you rip it apart. You can go to Facebook and go to the contest will be pinned to the top of the page. Go to Twitter, Instagram, or TikTok if you want a 60-second version of our program. We actually have another channel where we have little clips too, 60-second clips.
Oh, good. That's all they can. Some people can't take
clips
anymore than that.
Yeah, that's right.
Oh, but with the pillow.
Oh, yeah.
This is what they look like on the end. If you cut this apart, this would look like. And they've got actual springs inside the pillow, but you cannot feel them out here, but they're in there, and
they give a good support.
They do.
I think it's a great side sleeping pillow. If you're a side sleeper,
they give you a lot of that airflow is in there.
This mattress is by far the most comfortable mattress I've ever had. I haven't tried them all.
Yeah, but I'm very happy with mine. Anyways, we got to get on with the Piriformis and hip problem.
All right.
Now, Bob, we need to talk about this. As therapists, we know if the doctor gives us order, it says piriformis hip pain, the first thing, not the first, but one of the first things we're going to think about is we need to rule out, is it part of the low back?
Right. Is it the back causing the pain and not the piriformis?
So for a little brief explanation, we need to refer to Sam. Sam I am.
Yeah.
He is our skeleton model, and he's been very good to us in the last few years. I need my stool as well.
Oh, you made the muscle in black.
Yeah, I did, because he's got white bones, and it's just a little easier to see. Liz, can you see the location of the piriformis muscle? So I don't have exactly where it connects. It's actually underneath the sacrum, but for this discussion, it's not that important. From here down to the hip, greater trochanter is where that muscle goes.
A little bump.
That's right. And then, the hip is here. So if you got pain from the piriformis or the hip, they're located right next to each other. So you got to determine which it is, but also the back. Now, the low back, oftentimes you'll feel pain in the low back, but it's not uncommon for the pain to refer distally or down into the buttock, into the hip, and down into the leg. Which, by the way, Bob and I, we know that the piriformis muscle can also refer pain down the leg as it pinches the sciatic nerve. So you really need to kind of rule out at least low back. And there's one way, I think, and Bob, you may have some other input, but
sure.
The 2 options that are, the layperson can do without too much problem.
Yeah, the sciatic nerve travels underneath the piriformis or through it.
Yeah.
And so if the piriformis muscle is tightened down for some reason or contracted down, it puts pressure on that nerve and sends pain down your leg, and you think, I have sciatica.
Right.
And it's really not. It's false sciatica, they call it.
Either way, you still have the pain down your leg, just from a different source. But just something to rule out the back. If you're standing and you have your pain in your hip, and you go like this, and you extend, you keep your legs and everything still, but you just stabilize your back here and think of all motion going from above there in this direction. If that changes that pain particularly significantly, there's a good chance you got some low back involvement. But just wait, before you go any farther, let's assess even.
You want me to do it?
Yeah, go ahead. I want you to lay down. Probably on the floor would be best. You could do it on the bed, but floor is better.
Lie down.
Lie down, yes. And I want you to think that your waist is glued to the floor. And so everything, the hip, is all completely motionless.
Yeah, so the piriformis is not kicking in whatsoever.
No hip motion, everything down here, and then you're going to do a press up. Now, if you have pain doing this, particularly in the leg, in the hip or down the leg, it's very, very certain that you probably have low back problem referring down. You could have low back problem and hip
Piriformis.
Yeah. But if you can do this, and it doesn't bother you at all, you can do this, no real change, then it probably is from the hip and or the piriformis.
Yeah, and the thing is, these are things that it's pretty, difficult sometimes for a therapist even to assess. But as a rule of thumb, if this recreates the pain, there's a good chance that it's the back.
Right. Yeah. Exactly. So let's say you did your extension exercise that we just demonstrated. Didn't change anything. We've got the hip and the piriformis to work with. Now, the second step is this is how we're going to do this. Why don't you move, Bob?
Sure.
I'm going to do knees like this, and we're going to simply bring the knee up and over to the opposite knee, and this stretches the piriformis.
Yeah, this is the one that's painful, the right side.
Let's say you do this and you feel it pull tight there. Make sure you do the other one, because if that piriformis is tight, I've had many patients say, "Oh boy, I feel it right in here," and then the other leg that doesn't hurt.
Yeah, it's Brad, almost universally.
Yeah,
it seems like I found it to be that true.
Exactly.
So it's another sign that it is piriformis.
Right, and then you can also just do the knee straight up, and that might give you some indication of the actual hip joint itself, and it will take out some of that piriformis involvement. This hip might go up to here, and this one, this is no problem here. So then you may have some hip tightness as well, and that's the thing. It may not just be one or the other. You could have,
you could have
your
hip pain.
piriformis could be tight as a result of a painful hip.
Sure. Or vice versa, your hip got tight because your piriformis hurts.
Right.
You don't want to move your hip.
What comes first, the chicken or the egg?
Yeah, right.
Well, we shouldn't discuss that because we've got other work to do. Anyways, do the figure 4. So ankle goes above the kneecap on the thigh, and then check range of motion this way. Now, this is not going to check. This is more the hip joint, not so much a piriformis, but there's some involvement that way too. If you find that this one only goes to here, or you even have a hard time getting your foot up to there, and this one drops like this.
I don't know if you remember, Brad, though, the piriformis actually is an external rotator, and sometimes it's an internal rotator when it gets up there farther.
It gets kind of complicated.
It gets complicated.
Right.
So you probably are actually stretching the piriformis if you get up like this.
Right.
And then push it down.
I knew he was going to get
it.
it.
Yeah, you knew he was going to say something.
I wanted to keep it simple.
Right, and that's the case. You don't even need to. So should they be doing those stretches?
Well, yeah. If they're tight, then you are going to do the stretch. But before we go any farther,
and those stretches, are good for you no matter what. I mean, even if you don't have piriformis.
Right. Even if, and I do them myself.
Right.
But if you got the painful hip and you want to get that piriformis muscle stretch as well as the hip muscles, this is what we're going to show you. This is step number 3, the treatment part.
Sure.
One thing you can do is before you do the stretches, we're going to do this on the floor. You can do a little foam rolling. Now, I like the foam roller. There's some things I like about it, some things I don't like about it. Is one, you can work it, and as long as you can do this. Some people may have shoulder problems if you're a little older, you have some injuries. You may not be able to control the weight, but we have another option.
Yeah, Brad's not putting full stress on that.
No.
He's able to take his arms, and so
I've got about 50% of my weight on there, and if it's sore, you need to.
And he's kind of rolled towards that side, where he could roll off it a little more and take even more stress off it. Yeah, like that.
Now I'm on the sacrum mostly.
Yeah.
But you're going to work that, and you'll get a feel for it. When you get over that tender, tight muscle, that piriformis, you're going to have to tread lightly on it and then work into it. You'll do this for a minute or two and longer after it starts to loosen up.
I wouldn't do this one, Brad, though, if it increases your pain. Do you know what I mean? It starts sending pain down your leg.
Yep. Yes, particularly that leg
if you have a little
symptoms.
soreness right as you roll over it, that's fine. But don't increase that leg pain down, down the leg.
Yep.
That means it's too tender. You're going to have to maybe use the next step and massage around it.
Exactly. Which and these massage guns are getting so popular now. I've got orange tape on it just so you can see this on my black pants. But I use the round ball.
Sure.
You may want to this.
Take up 5 attachments.
Right.
So
You're probably going to use either the airhead, that's just a little softer to get started. The round ball is a little more aggressive, and then they have some other heads that are really aggressive.
yeah, this would be really aggressive.
The
The pointer,
pointer,
and
yeah.
that's the one I use on my calf right now.
Sure.
So
But to start out with, go with this, and you'll get a feel for what you need. So I'll demonstrate. And I have a patient right now. He's going to have a hip replacement probably in about 9 months. He's trying to hold it
Sure.
off, and he's using the massage gun as part of his treatment. Chris.
oh, sure.
Yeah. So I'm going to get this thing going. You can see this
It's
going
good
to
because you're
town
going to have
here.
black on black, so it's good that you got the orange on
Yeah.
there.
So this is a reciprocating gun, and you need to have a gun that reciprocates
Yeah,
to
it's
get
not
you-
just vibrates.
Yeah, it's going to get into that muscle. You got large muscle mass here.
And also, you don't want to go cheap on these things. Like the ones, if they're like 20, 25 bucks or something, they're junk.
Right.
So,
And on the other hand, they sell them for $400 to $500 still.
Right.
And they're probably good guns, but you can get a real nice one for around $100, it's
Right.
120, 30.
now,
And
Brad,
go
I
ahead.
have found on the Piriformis muscle, this is what treats it for me. I mean, I've had the best luck by doing massage on it.
Sure.
And
Ooh.
you know, you can use your hand to do it massage, but you're going to wear out very fast. So anybody I've had, including family members, if they had a Piriformis problem,
Yep.
I sent them a massage gun.
Sure.
Because-
And, in the hip, like with my patient who's going to hip replacement, I don't know if we can roll Sam over.
Sure.
Then we can see, we want to get those muscles around that hip capsule as loose as possible so that when you have surgery, things are loose and you're going to have a better surgical results. So I'm going over that Piriformis right here. You don't want to go
on the bone,
That's
right.
just going to hurt like, the Dickens. And here and
There's
over
the
on the
sit
top.
bone too. You don't want to
Yep,
hit that.
Yep. You're going to go into the muscle. And you can even get into the front a little bit here. Touch on that lightly.
You don't want to be in the femoral crease where the lymph nodes are.
Right. Okay. So you can work with that.
The big thing is too, you can work around if there's a real tender spot, work around it, and then eventually go into the tender spot.
Exactly.
So,
And you'll feel the tender spot, especially
Yeah.
that Piriformis. There's a trigger point down there typically. The patient, you can always,
yeah,
they'll let you know it.
yeah,
And
you'll see
you'll
them
feel
from
it.
the look in their eyes.
And I'll just review the stretches. So, you can do that, work the massage, work the roller first or the massage gun, and then do your stretches. And I like to start with the knee to chest first. It's not quite as aggressive. And you go pressure on, pressure off 10 times. And then you may go to the figure 4. And again, if you want to hold it for 15 to 30 seconds,
It's a great stretch to do.
Yeah.
Everybody should be doing this stretch, Brad.
especially when you get older.
Yeah, especially when you
Yeah.
get older. You get 50 plus, you should be doing this stretch.
Exactly. And
And we're eating our own recipes here because
Yeah.
I stretch it I stretched it this morning.
sure. And then you do the clamshell like this. You can grab. I do this actually. I use the
Ah.
belt, and then I put my elbows here and I stretch here just to get that abduction
Sure.
with the flexion. Get that loosened up, and when you regain motion, the pain almost certainly is going to come down.
Yes,
It
they
just
correlate.
yeah.
Like if you have tightness, the pain goes up, and as the hip becomes more loose, it goes down.
that's right.
So
All right. Good luck with
Guaranteed.
that hip. Be careful, and we can fix just about anything
except for a broken heart.
That's right.
But Valentine's Day is coming
Oh,
up. so
that's
we're gonna
right.
start
Yeah,
fixing
we
hearts.
could score double bonus on this. I even got my wife a gift yesterday. And I wrote a card out and I stuffed it in there and I got some stuff, but don't tell her I've got it hidden in the house.
All right. Yeah. Good job.
I'm going to have a good weekend.